direction towards the right. Then further you have to put for the charger, I believe. Yes. So now we connected the entire line. This line to be known as a motor line. This line to be known as a motor line divided into 5 segments. Upper 1/5 and middle lower 2/5 and then the lower 2/5. Remember, this is the very important. The people who are suffering for the hemiplegia on being very dangerous. If the left side happen, still it's okay, but because the problem is, if the problem is affected on this region, that means you apply the needle over this region, but this region, it causes the Broca's area will get affected, the vernix area will get damaged if the paralysis will get affected on the right side, because the right side the paralysis happen due to the left side the temporal lobe got some kind of the occlusion, some kind of the stenosis, or the middle cerebral artery get stagnated, or the obstruction which causing the problem. So therefore, once this happen over here, then the temporal lobe and also lower portion of the frontal lobe and the vernix area on the temporal lobe will get damaged. Due to that damage, the paralysis happen where the limbs cannot lift and the legs also having the problem. That particular time, certainly the Broca's area also affected, right? So that time speech also cannot come. By the way, you are activating to the entire region to treat for this upper 1/5 is treatable. The man is sitting like a ulta, the opposite inward direction. The head is here, the legs are here. Remember, in this way, the head is downwards direction, this is as a trunk and upper extremities, and this is as a lower extremities, isn't it? So therefore, now this upper 1/5 area is treatable for the hip region, the knee region, and the leg region can be treatable successfully by activating this region. When there is the upper 2/5, that means the middle 2/5 region, the 1, 2, 3 needles can be treatable. These 2 will be useful to treat for the trunk and also for the upper extremities. When the hands cannot lift or the abduction to be not taken place, in that condition, certainly strongly we stimulate this point. Further after this, there is the head and neck region is affected. That head and neck region can be treatable by activating this 2 points. But this is for the sensory related disorders and also for the hemiplegia related disorders. This entire region to be known as a somatosensory cortex region. Then we are talking about the motor area is very parallel to that region. Sometimes it having the mixed related problem. I cannot lift my hand, but I do have the pain also. But further he says the hemiplegia also happen. Neurological disturbances and also the pain related condition. So that time we can use another line, that line to be known as a quickly assist me. Now I am talking about this entire region to be known as a somatosensory cortex region. Then further, give me a few more needles. Then just I apply the 1 chun anterior. That means is the 1.5 centimeter anterior to that. So just we apply. How to understand that? Here is the scale. So we just measure this and all, not required. To show you, just I am doing this procedure. 1.5 centimeter. 1.5 centimeter anterior to this region. This called as a C shen chung. So this is I just applied towards this. Then further I just applied to the downwards direction, right? Further I just applied towards this. Then that means where is the GB? This is a GB7. This is a GB6. So GB is gallbladder 6 region. I just activate to the upward direction. One more needle I just apply here. That means from here to here. That means is the lower 2/3 I just activated. Now you remember the entire somatosensory cortex and also the motor functions. What are the difference between? Majorly, this is the precentral gyrus, the postcentral gyrus. The precentral gyrus points are these motor points. The postcentral gyrus points to be known as a somatosensory cortex region. But this having the major different role for the each and everything. But this all are pain related. When the patient having the hemiplegia, then you just use this point. When the patient having the hemiplegia with pain, you just apply the needle. The patient don't have the hemiplegia, again he have the problem of the pain as a lower back pain or something like that, then the lower back pain you just apply the needle over here. That's called as a somatosensory cortex. That also to be known as a there is a efferent nervous system and efferent nervous system, but this is called as a efferent nervous system, but this to be known as a efferent nervous system to be taken care by activating this point. Once you do, this is called as the upper limbs, this is called as lower limbs, this called as the upper limbs, this is called as a head and neck region, right? Hopefully any head and neck related, but especially you remember this is for the Broca's area also covers. This called as the Bolna, which I told you, the Paul Broca's is invented. This region to be known as a speech area. This area is not that one particular point is Broca's area, no, it covers this. It covers the entire region to be known as a Broca's area. Broca's area. This covers the entire spectrum to be known as a Broca's area. Hopefully we have done this. In this way we can do it. Then further there is the corino-tremor area, especially to treat for the tremors of the hand. Again you can divide it into 1.5 centimeter. So please be there, and this is something is so important. Now come to the 1.5 centimeter anterior to this region. You just apply to the downwards direction. This is a sandwich needling we are doing, and further it is connecting to the downwards direction, right? So this is we completed gallbladder 6. Now